Hello students, you're welcome to another class. Today we'll be looking at sexually transmitted infections. What comes to your mind when you hear of STIs? These are a group of contagious diseases that are transmitted mainly through sexual intercourse. Initially, they were called venereal diseases, but now things have changed. We now understand that there are several routes of infection because of a change in the sexual orientation. I mean, in these days, you hear of people who are homosexuals. So this has changed the definition from venereal diseases to what we now call sexually transmitted infections. The principal sites of infection include the moist surface areas of the penis, of the vagina, and the cervix. The other parts of the body, like the lips, the oropharynx, the anus, and the rectum, that are increasingly becoming important sites for infection because of a change in the sexual orientation. There are people who have rectal sex, particularly in homosexuals, and this is becoming a growing problem. In Nigeria, just as in many parts of the world, STIs is becoming a significant health problem. If you look at what happened during the case of the Mpox, problem, the multi-country Mpox outbreak in 2023, 2024, 2022, 2023, what happened was that within the homosexual population, it increased significantly and became a global problem. This sexually transmitted infections is driven largely by behaviors, multiple sexual partners, unprotected sexual intercourse, and then intravenous drug use. Some people engage in the use of contaminated sharp instruments. Some indulge in they take unsafe blood through transfusion. Some people in a very challenging situation, health challenge, they look for blood anywhere they find. They don't even check to screen the blood, and this creates a serious problem. What are the classifications and the types of sexually transmitted infection? The first thing is that based on the etiology, that is the cause, STIs can be classified. Also, based on the clinical presentation, how it's seen. Now let's look at etiological classification of STIs. This is on the basis of the cause, the causal agents. We have bacterial causes, we have viral causes, we have fungal and protozoans that cause STIs. You will get to see this as we move on. What are some of the bacterial causes of STIs? I am sure you have heard of gonorrhea. If you go to Bodija market, for example, or you go to you see some people selling some drugs, they'll tell you it can treat gonorrhea, it can treat syphilis, it can treat all these things. Gonorrhea is a very common STI, which is caused by Neisseria gonorrhoeae. Then we have some non-gonococcal, that is non-gonorrhea urethritis and cervicitis, which is caused by Chlamydia trachomatis. We also have another non-gonococcal urethritis and cervicitis, which is caused by Urea plasma urealyticum. Have you heard of chancroid? It is caused by Haemophilus ducreyi. Then syphilis was a very big problem then. It's still a problem now, caused by Treponema pallidum. And then we have granuloma inguinal, which is caused by Calimobacterium granulomatis. Also, we have bacterial vaginosis, which is caused by Gardnerella species. Now to the viral causes. HIV is a very common cause. But perhaps you say HIV is not as common. What about genital warts, genital herpes? Genital herpes is caused by herpes simplex. We have two types, herpes simplex 1 and herpes simplex 2. Then the genital warts. Genital warts is becoming a significant problem now in the hospital we are beginning to see cases of human papilloma virus. Human papilloma virus. Let me ask you to Google condyloma acuminata. Condyloma acuminata is an extensive form of genital warts, which is caused by human papilloma many times. It requires even surgical removal because of the quantity of the genital warts which has spread to many parts of the body. So do well to check and have a graphical look and picture of condyloma acuminata. Another cause of viral STI is hepatitis B virus. Again, this is becoming a very significant problem. In our laboratory, we have cases every week, of human hepatitis B virus. And this is transmitted, among sexual and also male homosexuals. Now let's go to the other form of classification, which is the clinical classification. And this is based on the presence or absence of ulcers or sore on the genital area. The genital area is moist, and chances are that healing may not be very, very fast. So if there is genital ulcer, we call it genital ulcer disease. If there's no genital ulcer, we call it non-genital ulcer disease. So in these two ways, we can also classify STIs. Take note, the first one is etiological classification, and the second, clinical classification. What are the examples of genital ulcer disease? The ones that cause ulcer. Syphilis is an example. Chancroid is another example. Herpes genitalis and lymphogranuloma venereum and granuloma inguinal. These are examples of genital ulcer disease. So if you want to classify them based on their ulcers, you have this, to list. Now we have the distinguishing feature that is seen during ulcerative STIs. For syphilis, it's just a single ulcer that is seen. The ulcer may be dirty, may be clean, it may be firm, and then there may not be pain. For syphilis, the groin, you'll find some groin pains. In the case of herpes, the ulcers are multiple. So if you see multiple ulcers, you are looking at chancroid, you are looking at herpes. But for granuloma inguinal, it may be variable. Again, you are looking at how firm it is or how painful. If there is pain, then you are looking at either chancroid or herpes. What about groin enlargement? You know where the groins are? Around the region just below the waist. So you are looking for abscess. Is there any abscess? Is there no abscess? Take note of these ones that cause abscess and the ones that do not cause abscess. Now let's go to the non-genital ulcer disease. These are STIs that do not have ulcers. The first example is gonorrhea. Then you have non-gonococcal urethritis or cervicitis. You have genital candidiasis. And you have genital warts. They do not present with ulcers. And when I'm talking of ulcers, what do I mean? This is a breach in the continuation of the skin. Okay? Like an abrasion. That's what an ulcer is. Let's look at the epidemiology, the distribution of sexually transmitted infections. It is not peculiar to Nigeria alone. Sexually transmitted infections are a global problem. In Nigeria, it is a significant cause of patients visiting the hospital, with a prevalence of about 9.3%. This burden is even compounded because of the HIV situation in Nigeria and in many parts, South Africa, for example, the high burden of HIV. So wherever there is HIV, the high rate of HIV, you expect to find a high burden of STI. And I will explain to you why this is so. Sexual behaviors, and then an active reproductive age within the community. You cannot have children without having sexual intercourse. But if the sexual intercourse becomes uncontrolled, then there is a problem. Hence, it is very common in a group of people, adolescents and low socioeconomic class people. And this is so for some reasons, as you will see soon. In adolescents, they have the tendency to always what we call copy. They don't know. They just want to try it. So, peer influence, a very strong influence on young people. When you tell them don't do something, they will do it. That thing you told them not to do is what they do. So the influence of peer pressure. Some people go to parties, they just go and dance, they drink, and then before you know it, they sleep with 1, 2, 3 people, and their eyes will now open the next morning. Are you sure I'm the one that did this? There's the need to experiment with sexual activity. It's an experiment for them. When their eyes open, then they will know, they'll be sorry. So for young adolescents, they fall victim of this problem. What about poor socioeconomic class? How does it predispose people to STIs? The poverty level, is really very bad. Some people have engaged in, sexual activity just so that they can make money to get by. Somebody said you use what you have to get what you want. But in the process, you collect STI. You take it home. If it is HIV, then it's forever and forever. This is a common scenario with commercial sex workers. But there are also some married women in polygamous relationships. They go out because the husband is not able to provide for all the wives. They go out to go and look for greener pasture from another marriage. They go outside from outside their marriage. They go seeking for financial assistance. This predisposes them to sexually transmitted infections. When people belong to a high socioeconomic class, they indulge in extramarital affairs. This extramarital affairs is a way of showing off. They have money. And some people will tell you, you are a rich man and you have only one wife. You are not rich. If you have one, I don't want to mention names, but then there used to be a very rich Nigerian, very, very rich. Anywhere he goes to, he has a child. And the moment a woman has a child for him, he gives the woman. In those days, he gives 1 million naira to take care of the child, at least to start with. He was a very rich man. Sexually transmitted infections can occur in any gender, including homosexuals now, and at any time of the year. It is not just the Harmattan thing or a rainy season affair. Anytime, it can happen. Anytime. What are the risk factors for sexually transmitted infections, including HIV? The female gender, they are very prone to STIs compared to the males. One reason for this is because of the surface area of the female genitalia. Another reason is that females usually have the tendency to have the first sexual experience at a much younger age. Females have the tendency to have the first sexual encounter, what you call the sexual debut, at a much younger age. But we observe that some occupations are predisposed to, sexually transmitted infections because they have high mobility rate. Look at long distance truck drivers. The man who is coming from Sokoto is spending how many days on the road? Maybe in a month he goes to his home only once. He spends the road, the vehicle spoils, so he gets to a place called Jeba. In Jeba, he spends 2 weeks there trying to fix the vehicle. In Jeba, he has a sweetheart for sex. He moves, he gets to Ogbomosho. In Ogbomosho, he has another one. He moves, he comes to, as he's drawing closer to his destination, depending on what happens, he has a chain, a sexual chain. Also, armed forces, Nigerian soldiers, it is on record that when they went to Liberia to fight the Liberian war, they left behind some children who do not know their parents. Because eventually, when the war was over, they left. They left Liberia and they came back. So, they left their children there. As they move from place to place, they leave children there. It is common with the armed forces. What about the salesmen? Salesmen, as they are moving to sell their wares, in the same vein, they are contracting STIs. There are some husbands, long distance relationship. It is not the best. It predisposes the spouse to sexually transmitted infections. A stable marriage where both couples stay together is a guarantee against acquisition of sexually transmitted infections. Although the disease is known to cut across different social strata, people with a lower level of education, which of course translates to lower social status, are prone to STIs. How do I mean? There's a saying that knowledge is power. You can't be knowledgeable except if you invested some time and money. So the one who has a PhD program has invested more into his education compared to the secondary school dropouts, who perhaps due to low social class could not complete his study. This course was midwifed in some years back, about 8 or 10 years ago. Then, of course, students were not introduced into the general studies program where they take GES107, and so they were exposed to risky sexual behaviors. But immediately we started this course, we discovered that the behavior of students in the University of Ibadan and some other 7 schools in Nigeria changed. You have now become ambassadors to know what not to do, at every point in time. Having multiple sexual partners is a guarantee for obtaining sexually transmitted infections and HIV. Multiple sexual partners. Yes. And in fact, ulcerative genital lesions such as syphilis, chancroid, herpes that we have mentioned increases the chances by 100-fold of getting HIV and sexually transmitted infections. It increases the chances of getting HIV.